8:40, Riley in for Brian this morning with Susan. Good morning.
Morning. We also have a special guest. Dr. Tiffany Nazareth joins us. She's an optometrist at St. Lawrence Optometry. She's here to chat about the importance of eye health and a great program that is helping out our young ones. And of course, you know, we're just less than a week. Well, I guess this is week 2 of school. So I know parents might be, and teachers might be noticing, you know, maybe some difficulty with their, you know, kind of like squinting. I was going to say at the chalkboard, but I don't even know if that's a thing anymore.
Yeah, that's dating ourselves, I think. So Dr. Tiffany, thank you for joining us. Tell me, what exactly is the IC Learn program?
Great, thanks for having me, guys. So I Learn, and just for those listening, it's EYE, optometrists love puns, but it's part of a national children's vision initiative to help build awareness for parents and teachers about the importance of eye health and vision care as part of a child's best start to learning. It is now Ontario-wide, and any child who is in junior kindergarten who requires glasses can get a pair of complimentary frames and lenses at no cost, sponsored by participating optometrists, as well as our industry partners OGI Eyewear and Nikon. This helps to kind of remove the barrier of cost for families, and also just helps ensure that children can see optimally during very important vision developmental and learning portion of their lives. And the program's actually been in effect since 2011, wow. But this year, as of July 1st, any child who's born in 2013 specifically is now eligible for the program this year. Yeah, it's pretty cool.
Fantastic. Now, what age should parents be taking their kids in for their first eye exam? And just, can you talk about just how important it is? Because I know that when you're not just, you can see a lot more than just your eyes. As an optometrist, right?
Yeah, so according to our Canadian Association of Optometrists, a first eye exam can happen as early as 6 months.
Oh, wow.
And a lot of people are kind of confused about that. They're like, how can an infant respond to an eye chart or see letters?
Right.
But there are a lot of objective findings that we're trained to look for just to make sure that a child's prescription is within normative ranges. There are other things to watch for in terms of health stuff, whether your child has a crossed eye or a white pupil. Those can be signs that things are off, or if they're just not meeting their developmental milestones. So 6 months is the earliest we do, but then we usually recommend 18 months, 3 years, and then annually after that.
Okay. So for teachers and parents out there, is there any kind of like signs or symptoms that we should be looking out for to see if maybe our child does need glasses? Totally.
So actually, studies show that 1 in 4 children actually have a vision problem. And so things to look for would include, but are not limited to, 1, an unusual eye appearance. So whether your kid has a crossed eye, a droopy eye, or a white pupil, as I mentioned, or watery eyes. Difficulty with learning. So whether they're moving their head in and out when reading, they're skipping lines or losing their position. If their behavior suggests a vision problem. So squinting, obviously, but blinking excessively, disliking near tasks, poor depth perception, hand-eye coordination, closing an eye to see better or turn their head a certain way, and of course even family conditions that are hereditary, so lazy eye, or even things like Down syndrome, cerebral palsy. All of these have vision associations as well, so those are some things to watch for.
Okay, interesting.
So if somebody's interested in getting in contact with the IC Learn program, what's the best way to get in contact with you?
Honestly, just visit the website. So it's EYECEYELearn.ca, IC Learn. Awesome. And then you can find, there are multiple optometrists in Kingston that provide this service. Our office is one of them, but you can go to locate a doctor and see which is closest to your family.
Sounds good. We'll definitely post that up on our social media so everyone remembers. And I mean, yeah, back to school, it's an important time to probably, I think everyone should probably be getting their eyes checked around this time. I haven't been for an eye exam in probably 20 years.
But it is covered for everyone up till age 19.
Perfect.
Yeah.
Okay, I'll see you soon.
Okay, thanks.
Dr. Tiffany Nazareth from St. Lawrence Optometry, thank you so much for coming in.
Thank you.